Welcome you all in a new lecture series, and we are going to discuss cystinosis. Cystinosis, it is a cystine storage disease where there is a accumulation of cystine in a lysosome. It is a rare, but it is a serious lysosomal disorder. The exact reason of this cystinosis it is not known, but it has been suggested that due to the defect in an enzyme, there is a defect due to the inherited defect in a lysosomal enzyme where the conversion of these two molecules of cysteine into cystine or conversion of cystine into cystine. This is done by the cystine reductase. Now, whenever there is a deficiency of this enzyme cystine reductase, the conversion of this cystine into cysteine it is impaired, and this cystine it start accumulating into the lysosome of various tissues. So this crystal it is not metabolized, and they are starting they are depositing into the in a tissue. So cystinosis it is characterized by the deposition of cystine crystal in a tissue and organs of reticuloendothelial system. There is accumulation of this cystine into the lysosomes of reticuloendothelial system. So what are the reticuloendothelial system? That is the liver, bone marrow, lymph node and kidney. So ये जो cystine है ये डिपॉजिट होगा लीवर, किडनी, बोन मैरो, lymph node में डिपॉजिट होगा. And the symptoms of this cystinosis it is seen whenever the kidney is affected. As we know that the size of kidney is small, and the symptoms will appear whenever there is the function of kidney is impaired. So here first reason is there is a deficiency of enzyme cystine reductase. Second reason is second reason is it is caused by the defective carrier transport of cystine across the lysosomal membrane. This is our lysosomal membrane, and in which there is a this is a cystine, and here this is a lysosomal carrier protein called as a cystinosine. This is a cystinosine. This is a protein which carries this cystine from this lysosome into the cytosol. यहाँ पे जो सिस्टाइन है ये सिस्टाइन को साइटोप्लाज्म में कौन लेके आएगा? दिस सिस्टिनोसिन. But here if there is a defect in this lysosomal carrier protein, suppose this lysosomal carrier protein which is defective, when it is defective, whenever there is a defect in a gene, the gene जो लगता है, the gene which is responsible for formation of cystinosin, it is defective. So by the process of translation there is a formation of this cystinosin, and this cystinosin it will be defective. तो ये cystinosin cystine के साथ combine नहीं होगा, और ये cystine को इस lysosome से बाहर नहीं लेके आएगा. Normally what happens, it comes out with the help of carrier transport protein. Cystine comes out from this lysosomal membrane, but because of the defect in this carrier protein it will not come outside. Okay, so here now here you can see that there is a accumulation of cystine. As we know that there is a defect in a carrier transport protein, slowly there is a accumulation of this cystine, and this cystine it is slowly accumulating into the lysosome of reticuloendothelial system, and these are the crystals which are deposited into the lysosome. And this the clinical feature is because of the deposition of this cystine into the lysosome of reticuloendothelial system, and which impairs the function. So the most common organ affected is kidney, liver, spleen, lymph node and bone marrow. But out of that the organ affected is your kidney. So here you can see that how kidney is affected. So here you can see that there is an accumulation of cystine crystal into the lysosome, where there is a slowly accumulation of this crystal into the lysosome of reticuloendothelial tissue. So here these are the tissues where you can see the accumulation of this crystal. Here the accumulation of this cystine crystal into the tissue of liver, kidney, lymph nodes, spleen, and this accumulation responsible for cystinosis. That's why it is called as a cystine storage disease. Okay. Now here you can see that it's the normal kidney, and normally there is a filtration and reabsorption. So let's zoom this part. Now here we are going to zoom this part. After zooming, let's see what happens in the normal kidney. So here in normal kidney there is a filtration is there, and after filtration there is a reabsorption. So here it is a reabsorb. This is a normal mechanism of kidney to reabsorb amino acid and glucose. What happens whenever there is a cystinosis? So here it is not reabsorbed and it will go continuously and it will come into urine. It is not reabsorbed. Why? Because there is the accumulation of this cystine crystal into the reticuloendothelial system of this kidney, that is in lysosome, and it will impair an absorption of this glucose and amino acid, so that it will appear into the urine. So there is a no reabsorption. Okay. Then you can see that the clinical feature of cystinosis, that is cystine storage disease, it is accompanied by generalized amino acid urea, glycosuria, and polyuria. There is a no reabsorption of this amino acid, glucose, and polyuria. So patient usually dies within a 10 years due to the renal failure. Why renal failure? Because the kidney, it is a full of your cystine crystal. So it will not work properly, and because of that there is a death. Okay.